10 foods and drinks to avoid if you have hypertension. If you are diagnosed with hypertension, your healthcare provider will give you advice on how to manage it, whether through lifestyle changes, like starting an exercise routine, or eating more healthily, and/or medications. To help you get started, here's a list of 10 foods and drinks to be cautious of or avoid to help you lower your blood pressure. 1. Table salt. Salt is one of the most problematic ingredients for people with high blood pressure, and it's important to make sure you don't eat too much of it. This may seem easy enough, but salt is actually quite hard to avoid. Many people, including myself, love to add salt to their food. After all, it's an easy way to increase the flavor profile of any dish. It can also be hard to tell if foods have a lot of salt in them. The CDC has found that on average, people eat more than 3,400 milligrams of salt every day, which is above the maximum recommendation of 2,300 milligrams. The American Heart Association (AHA) estimates that for people with hypertension, reducing salt intake to 1,500 milligrams a day, less than half a teaspoon, can help lower systolic blood pressure by almost 5 mmHg. If it's difficult to cut salt out of your cooking, focus instead on other ingredients that can help make your dishes taste better. This brings us to the next point. 2. Sauces and condiments. When doctors tell people to avoid table salt, they often reach for condiments instead, like ketchup, steak sauce, soy sauce, barbecue sauce, or salad dressings. But, if you look at their ingredients, you'll quickly notice that they have a lot of salt in them, too. Even red and white sauces in Italian dishes have lots of salt, and so does gravy. This is called hidden salt. 3. Canned foods. Many canned vegetables, soups, and other food products are prepared with lots of salt for taste and to preserve the food. Doctors often advise patients to avoid these products if possible, and instead, eat fresh vegetables or low-salt soups. If you do need to use canned vegetables, you can buy the no salt added kind or rinse the vegetables before eating to get rid of the extra salt. Similarly, canned tuna is also often high in salt, so I advise giving that a rinse as well. 4. Processed foods. Similar to canned vegetables and soups, many processed foods carry lots of salt. This includes some frozen products, like frozen dinners and pizzas. My best advice here is to avoid these foods in favor of freshly prepared dishes. Or, if you have no other choice, look for low-salt or low-sodium versions. Some brands make healthier products for people with hypertension and heart disease. Those products will have the AHA logo printed on them and will have little to no salt added. 5. Unhealthy snacks. Everyone likes to munch on snacks between meals or at the end of the day. However, if you look at the snack aisle, what do you find? Chips, cookies, crackers, jerky, nuts, all of which have lots of salt in them. In fact, it's their salt, fat, and sugar that makes snacks so addictive. For example, popular chip flavorings such as ranch, salt and vinegar, cheese, and barbecue are all high in salt. Again, look for versions with little or no salt added. Another option is buying plain popcorn and adding your own spices, so you don't have to worry about salt at all. 6. Cured meats. Ham, bacon, and deli meats are often prepared by soaking them in a brine bath made with salt water and spices. While cured meats can be really tasty, it's best to avoid them. Watch out especially during the holidays, when you go out to eat, and especially when you're making a sandwich. Sandwiches are really high in salt because bread, cheese, condiments, and deli meat all have salt. It is quite easy for one sub or sandwich to have over 2,000 milligrams of salt. 7. Pickled foods. Similar to cured meats, pickled vegetables also carry a lot of salt. Pickling is a process where food sits in a solution of salt to kill off bad bacteria and other flavoring agents. Because of this, pickled foods often are high in salt. If you're concerned about your blood pressure, avoid eating pickles or other pickled foods like kimchi and sauerkraut, or at least wash them before eating to get rid of some of the salt. 8. Alcohol. An alcoholic drink can raise your blood pressure slightly, but if you drink too much, your blood pressure may rise dramatically. For people who drink alcohol on a daily or semi-daily basis, cutting back to recommended levels can lower blood pressure by about 4 mmHg. The AHA recommends that men drink no more than 1 or 2 drinks a day and women drink no more than 1 drink a day. One drink is defined as 12-ounce beer, 4 ounce of wine, 1.5 ounce of 80 proof spirits, or 1 ounce of 100 proof spirits. 9. Caffeine. Coffee, tea, and energy drinks often come with caffeine, which can cause your blood pressure to rise. For people with a healthy blood pressure, caffeine really isn't an issue, but if you have hypertension, it's recommended that you limit your caffeine intake and choose decaf or half-calf coffee or caffeine-free teas instead. 10. High-fat foods. While high-fat foods may not directly raise your blood pressure, they can pose other problems, like raising your risk for high cholesterol and type 2 diabetes. The mixture of hypertension, diabetes, and high cholesterol can dramatically increase your risk for heart problems. To correct this issue, following a healthy diet, such as the DASH diet, can really be helpful. As you can see, many foods and drinks can increase your blood pressure, oftentimes through hidden salt. It's easy to consume a lot of salt without being aware of it, so make sure to check nutrition labels when you can. Limiting your intake of salt, maximum daily limit of 1,000 milligrams, alcohol, caffeine, and fats is really important if you have hypertension. If this is a challenge for you, talk to your healthcare provider about referring you to a nutritionist who can help you explore healthy options and cooking tips. Here are some advice on lifestyle and home remedies for lowering high blood pressure. Lifestyle changes can help you control and prevent high blood pressure, even if you're taking blood pressure medication. Here's what you can do. Eat healthy foods. Eat a heart-healthy diet. Try the dietary approaches to stop hypertension called DASH diet, which emphasizes fruits, vegetables, whole grains, poultry, fish and low-fat dairy foods. Get plenty of potassium, which can help prevent and control high blood pressure. Eat less saturated fat and trans fat. While you can reduce the amount of salt you eat by putting down the salt shaker, you generally should also pay attention to the amount of salt that's in the processed foods you eat, such as canned soups or frozen dinners. Maintain a healthy weight. Keeping a healthy weight, or losing weight if you're overweight or obese, can help you control your high blood pressure and lower your risk of related health problems. In general, you may reduce your blood pressure by about 1 mmHg with each kilogram, about 2.2 pounds, of weight you lose. Increase physical activity. Regular physical activity can help lower your blood pressure, manage stress, keep your weight under control and reduce your risk of many health conditions. If you have high blood pressure, consistent moderate to high intensity workouts can lower your top blood pressure reading by about 11 mmHg and the bottom number by about 5 mmHg. Aim for at least 150 minutes a week of moderate aerobic activity or 75 minutes a week of vigorous aerobic activity, or a combination of moderate and vigorous activity. For example, try brisk walking for about 30 minutes most days of the week. Or try interval training, in which you alternate short bursts of intense activity with short recovery periods of lighter activity. Aim to do muscle strengthening exercises at least 2 days a week. Limit alcohol. Even if you're healthy, alcohol can raise your blood pressure. If you choose to drink alcohol, do so in moderation. Don't smoke. Tobacco can injure blood vessel walls and speed up the process of buildup of plaque in the arteries. If you smoke, ask your doctor to help you quit. Manage stress. Reduce stress as much as possible. Practice healthy coping techniques, such as muscle relaxation, deep breathing or mindfulness. Getting regular physical activity and plenty of sleep can help, too. Monitor your blood pressure at home. Home blood pressure monitoring allows you to keep a daily log of blood pressure measurements. Your doctor can review the information to determine if your medication is working or if you're having complications. Home blood pressure monitoring isn't a substitute for visits to your doctor. Even if you get normal readings, don't stop or change your medications or alter your diet without talking to your doctor first. If your blood pressure is under control, ask your doctor about how often you need to check it. Practice relaxation or slow, deep breathing. Practice taking deep, slow breaths to help relax. Some research shows that slow, paced breathing, 5 to 7 deep breaths per minute combined with mindfulness techniques can reduce blood pressure. There also are some devices available that promote slow, deep breathing. According to the American Heart Association, device-guided breathing may be a reasonable non-drug option for lowering blood pressure, especially if you have anxiety with high blood pressure or can't tolerate standard treatments well. Always seek the guidance of your doctor or other qualified health professional with any questions you may have regarding your health or a medical condition. Never disregard the advice of a medical professional, or delay in seeking it. If you think you may have a medical emergency, call your doctor, go to the nearest hospital emergency department, or call the emergency services immediately. Always seek the advice of your physician or other qualified healthcare provider before starting any new treatment or discontinuing an existing treatment. Talk with your healthcare provider about any questions you may have regarding a medical condition.